Hello everyone, good evening. Here we are back with yet another episode of BMC Global Live AlHilal Health World, nothing but lifestyle. This talk show is purely dedicated to all your health related queries and concerns. Thyroid is an extremely significant gland that controls the normal functioning of our body. To speak about thyroid, its significance and other disorders, we have with us Dr. Rahul Abbas from AlHilal Hospital, Adliya. He is a specialist in internal medicine with an experience of more than 12 years and he focuses on lifestyle disorders like diabetes, hypertension and other endocrine disorders like thyroid. So, doctor, welcome to the show and thank you for joining us today.
Thank you.
So, doctor, now we observed World Thyroid Day recently. So, please brief us on thyroid and its functions.
Very good. It's actually great that you brought this topic, thyroid. It's been long that we see too many thyroid cases in the recent past, but the focus on really why we have, what is it, is normally not normally looked into. Let us say why. See, if we speak about a cancer, you have a large number of audience to listen to, lots of investment on it. But when it comes to thyroid, you don't see so much of knowledge spread. Maybe that is the reason why we have Thyroid Week, Thyroid Day celebrated. Basically, thyroid is a disease which we are not really scared upon, purely because if you look at it, what is almost or always done is just one tablet. So if it's just one tablet, you can get cured of thyroid. So you are not really worried about because there's nothing in it. So it's not to spread fear, but to give you an idea that why we should all have it or what we should know about it. It's worthwhile to discuss about it, and this Thyroid Week, they are aiming as to make thyroid disorders one among the non-communicable diseases like diabetes, hypertension. So what is thyroid, as you asked me? Thyroid is basically a gland all of us have right here in the neck. Okay, so if I'm going to cut my neck skin and open it, I'll be coming across the thyroid gland, which is there for all of us. So people ask me in their common language like, doctor, do I have thyroid? They believe that when they say, do I have thyroid, that whether I'm having something abnormal. No, thyroid is a gland all of us have, and we cannot survive without it as well in a normal way. From the birth of a child to the growth of a child, your quality of life is basically maintained by the thyroid gland. So it is basically that you do not lose anything, but you lose the quality of the life if the thyroid is affected. From your hair to your nails, the growth of your hair, the growth of your nails, your perspective, your personality, everything depends upon thyroid. So if you do not have, or if a thyroid is less or a thyroid is more, it is not that you will have a heart attack or a stroke or nothing like that, but it will affect your quality of life. So quality of life, that quality, the way you live, the way your health is controlled by basically the thyroid. In children especially, this is the one main important hormone that helps in your normal growth, both physical and intellectual. So imagine that a guy with a lack of quality of life, a child who is growing up with a poor quality of life. Imagine this is not welcoming at all. So though from outward you may not look that the disease is so grave and dangerous, but from the person within, what is going to happen is you are going to lose your quality, you are not able to enjoy the pleasures of life, then your family life, everything gets disturbed. So in short, I would say thyroid is that gland which is actually maintaining the harmony of your system. So if all your systems work in harmony, work in color, work in quality, when you have a good thyroid. So this is what the thyroxine or the thyroid hormone does. So it's a gland that is there in your body which is producing a hormone called thyroxine. Now this thyroxine is this magic hormone that does this harmony work, just like the harmony of the orchestra, who just aligns all the other systems perfect. So this is what actually thyroxine literally does. So it acts like to maintain basically your quality of your life.
Now, what are the common thyroid problems that you come across in your OP these days?
Okay. Now, if you look at the most common thyroid disorder that happens is low thyroid. Your thyroid hormone is unable to produce enough and more of thyroxine. So the hormone is called thyroxine. It is produced by the gland thyroid. Here what happens in this disease, your hormone is less. Your thyroid gland is not enough to produce enough of hormone. So when the thyroid gland is not producing enough of hormone, you suffer from something called hypothyroidism. Why I say this, even though common man is not learned in this, but they speak these words, hypo, so without actually knowing. Maybe this time that we can tell them that when you say hypo, it means the body is producing less of thyroxine. So this is one thing that is most commonly seen. Another disorder can be this gland can produce more of thyroxine, then you called hyper. So here the thyroid gland is more active, it is producing more of thyroxine, that is called hyper. Now other than these two, you still can have disorders like cancer, where which is a different entity we will keep aside. Then can have infections, you can have infections of the thyroid, you can have fibrosis, you can have another a small segment, but grave diseases. But basically most commonly you come across low thyroxine called hypothyroidism and high thyroxine called hyperthyroidism. Hyper, this is how the most common diseases you encounter in our daily practice, which is both hypo and hyperthyroidism.
So doctor, if a person comes to your hospital with thyroid, what are the services you have to offer at AlHilal?
Very good. It's a good question that you asked us, that what AlHilal can offer for us. Yeah. See, if you know that you are actually thyroid, you have a thyroid disorder and you want to evaluate, what a doctor does is, first of all, a doctor analyzes your symptoms. He goes through what you are suffering from, because the symptoms of hypothyroidism and hyperthyroidism are different, or the symptoms pertaining to suspicious of cancers are different. So first you meet the doctor. So AlHilal has a large spectrum of internal medicine specialists. We have almost 8 centers with an extremely large number of specialists in internal medicine. We also have ENT doctors attending to thyroid cases, and also we have a long list of GP doctors attending to this. So we have a large spectrum of resources that you can use, you can avail, because accessibility is the first thing. So you come, you have it. Now what does doctor do? The doctor is going to evaluate your history. He takes a big history and he tries to examine you to see how much is your thyroid grown, is there anything palpable. So he examines that part. And the next thing what he does is he evaluates. So in our hospital, we have all the hormones that can be tested for thyroid. So you have to estimate how much is your hormone produced. So there are 2 hormones that we basically test for. We test for thyroxine as such, that is the hormone secreted by the thyroid, and we also test for something called TSH. Now this is the one thing that people always commonly look into. So TSH is a thyroid stimulating hormone, which is basically not produced by the thyroid, it is from the brain. So we measure that because that is the hormone that stimulates the thyroid to produce thyroxine. So in our hospital AlHilal, we can check both the thyroxine as well as the thyroid stimulating hormone and all the hormones related to it. And moreover, now when that is done, you know whether it is hypo or hyper, we understood that the thyroid level is gone high. We have 2 more options now. We have to check the thyroid, whether there is a growth in the thyroid, or is it enlarged, or is there something growing inside it, or it is fibrosed, whatever it is. To check that, you should see the thyroid. To see the thyroid gland, we can do an ultrasound scan, which is also available in all our branches. So if we have a radiologist who is specialized in doing thyroid. So if you go there, they do a thyroid scan and see the thyroid gland. You can look at the thyroid and see exactly what is happening in thyroid. So that is also one part of the evaluation. Now this is not complete. If you look at the diseases of thyroid, mostly whether it is hypo or hyper, most common causes is autoimmune. Autoimmune means the reason why you got the thyroid disease could be because of your own immunity. So what is your immunity? Your immunity is the capacity of your body to fight against the bacteria, viruses, fungus that come from outside. Now, if your immune system is like your defense system, which is fighting against these, and imagine a condition that your own defense system now tries to attack your body, that is called autoimmune. Now, if your defense system is producing something called antibodies as your weapons, and this antibodies act against your own organ, it is called autoimmunity. Now for the thyroid disease to happen, the most common thing which we encounter as the cause is these antibodies of yours fighting against your own thyroid causing the disease. Now, how do you know that? We can check the antibodies. So at AlHilal, our lab facility, instead of, along with checking the thyroid hormones and the thyroxines and the TSH, we also can evaluate for the antibodies. There are antibodies specifically acting against the thyroid, like anti-TPO, anti-thyroglobulin, anti-TSH. Forget about these names, but these are the antibodies that can attack your thyroid. Now when we measure them, we understand that yes, this is the reason that you are having a thyroid disease. So at AlHilal, from the consultation, through the ultrasound, through the lab, we get a complete evaluation of thyroid and thyroid disorders. So you are, the good thing that I will say about AlHilal is accessibility. We have 8 branches, we can go anywhere. And affordability. Yeah, because I can vouch that among all the branches or all the hospitals in Bahrain, we cater with a very low price and cost for, and very flexible also for all classes of patients. This is what AlHilal in a wide spectrum can do for the society as well.
Doctor, you already mentioned about hyperthyroidism and also hypothyroidism.
Yeah.
Can you explain the symptoms in detail?
Exactly. Now, when people talk about hypo and hyper, though the names are very familiar, as I told you, you should be aware that how they present also. But strictly to start with, this is not like a cut of margin that if this comes, it is hypo, if this does not come, it is not hypo, no, nothing like that. But on a broader scale, I will just tell that symptoms. Why I prefaced this statement is because people have a notion that if this comes, it is only hypo. If this is there, it is only hyper. No, it's not like that. I will take that preface first. Let us look at it. Hypo, because thyroxine is being produced less, hypo. So what happens? Your body is having low thyroxine. When you have low thyroxine, what happens is that you will feel gloomy, you will feel tired, you will feel lazy, you will feel fatigued. You just want to sleep always. You do not have energy. Literally, as I told you, your quality is lost. You are like somebody who does not want to enjoy the life. You live your day, you wake up in the morning, you do your household, you go to your office, you do your office, you come back, you take care of your family, you sleep. But still, if you ask this guy, how are you, you really won't get the real answer of having a quality. So what you lose there is the quality. Along with that, these are the emotional things you have. The patient can have emotional lability. They get angry very fast, they get sad very fast. They find difficulty in tolerating heat and cold. Sometimes they find that they are unable to tolerate the temperature variations. They have hair loss. And in females, very importantly, they have period abnormalities, irregular cycles, and weight gain also. Now, these things I mentioned are the hardcore features of hypothyroidism. Okay, but that does not mean that this cannot be there in hyper. But these are basically on a broader scale the features of hypothyroidism. When you come to hyperthyroidism, here your body is producing more of thyroxine. So since the body is producing more of thyroxine, you become more active. So your basal metabolic rate goes high. You become hyperexcitable. You become angry very fast. You start to lose your weight. You go slim. You start to have tremors, your hand shakes. So if you see that somebody is having a tremor of your hands and you find also that you are losing weight, think about thyroid. And I will give you one example. I tell my patients, I had once a policeman coming to me just with one presentation that he came to me on his uniform in my OPD and he told me one statement, doctor, I have an issue. I said, what is it? That I had to assault a man today. I said, what was the reason? He said, doctor, it's not that it was the reason is logical or not, but I had never ever gone this angry. And then I said, if you believe that, if you think there is a disease in you, then it should be the thyroid that should look into you. So if you are getting emotionally angry very fast and you have tremors, you have difficulty to control yourself, I would say look for hyperthyroidism, hyper, where your thyroxine is more, as one of the things. So in hyperthyroidism also, you will have hair loss, you will have irregular periods, but more specifically, you will have more of heartbeat, more of palpitation, more of tremors, weight loss, and getting angry very fast. These are the symptoms of hyperthyroidism.
So if we have the symptoms, we have to check the thyroid hormones. Yeah. So once diagnosed with thyroid disorder, what are the treatment options you would suggest?
Very good. Now, depending upon the type of disease you are going to encounter, you step into treatment. Okay. Now, this is the most important part. Among every man, any part of the world, the one inhibiting factor we doctors face across all diseases is that when it comes to treatment. Nobody in the world really does want to take a medicine, whether it is for diabetes or hypertension or thyroid or whatever may be the disease. Nobody wants to take a medicine. It's a true statement. So that is the problem we face. So before explaining on the treatment, let me divide it into two groups, hypo and hyper. The most common we come across hypo. So in hypothyroidism, the treatment is, you do not have thyroxine, right? Your body is producing less thyroxine. So what we should give you? We should give you some thyroxine. So literally, the medicine that we give you is the same hormone that is lost. Now people think, doctor, but should I start this because this is a tablet, it's a medicine? I would say don't look at it like this. You are having less hormone, you are taking that hormone. The doctor said medicine, right? I'll give them one example. Imagine that somebody met with an accident and lost around 2 liters of blood or something like that, and you take him to the hospital, and the doctor is going to tell you, dear, your brother needs 2 pints of blood. Will anyone ask them, oh doctor, is it too much, 2 pint, 2 dose? No, can we make it 1 pint and 1 dose, so let's dose? You don't ask that. You say, yes doctor, we need, because he lost it. So it is just like that. How much you lost, you are taking it. So you do not ask for, doctor, will it be over? Is it going to be dangerous? Because here you are only correcting your deficiency. So in hypothyroidism, treating with a tablet, a very small tablet, which can be taken by any group of patients, whether you are pregnant or you are newborn or you are an old man, you have a kidney disease, whatever may be the spectrum, you can take this without any side effects, because this is not a medicine that you take. It is only replenishing that has been lost. So for hypothyroidism, there is absolutely nothing that you should worry about. If you have a disease, please do the treatment, take the treatment. There is no harm with the medicine. When it comes to hyper, where your thyroxine is produced more, the treatment is not this simple, as I say. Now we have to evaluate, then we have to start with medications or surgery or radiotherapy. I'll tell about that. See, what is happening in hyper? Your gland is producing more thyroxine. Since it is producing more thyroxine, you have to make the gland produce less thyroxine, correct? So initial days, the best way was to remove the gland. You remove the gland so it will not produce any more thyroxine. Yeah, that was what has been done before. Now it is crude, we don't do that. The best is that you have something called radioiodine therapy, where there is something called radioactive iodine. You take the radioactive iodine, it's an oral syrup, you can just drink like that. When you drink the radioactive iodine, this radioactive iodine will go into your thyroid and ablate, burn the thyroid without any scar, nothing. So your thyroid will not produce any more thyroxine, and all the thyroxine you lost, you can take as the tablet. So you don't have any problem with that. That is the best and the first line of treatment. Now, radioactive iodine is not available in all places in the world.
And how long we have to take that?
Now, once you take the radioactive iodine one time, maybe twice, because your dose may not be sufficient, so 1 or twice. But in 2 cycles, it should be anyway over. But after that, you should take the thyroxine hormone, because you ablated your thyroid, so you will not have thyroxine again. So you're literally going to hypothyroid. So you'll be taking the thyroxine tablet. But still, that is very safe. And I told it's not a tablet, it's not a medicine, it is just replacing what is lost. Now, if the patient is not doing a surgery and unable to get the radioactive iodine therapy, then we have medicines. We can have tablets. Pretty safe, not that the best safe in the world, but pretty safe. You can take the tablet and you can keep your hormones under control, even with on tablets alone. So all the 3 modalities are available for treatment of hyperthyroidism. And interestingly, if you come across patients who are on tablets, are a huge number. It's not like a small number, huge number of patients. We serially monitor the thyroid levels when you are on the tablet, and we can even, if it is antibody mediated, you can even be able to stop the medications at some part of the time. I do not believe that hyperthyroidism, once I have it lifelong, I don't have to take it. This question doesn't exist at all. Any disease, if it is treated and if it can be maintained, it can be continued. Now, when you stop the medicine, that does not mean you stop the treatment. Stop the medicine does mean you are not on tablets anymore, but that does not mean you should stop checking. You must constantly keep evaluating your thyroxine lifelong. That is for sure. But do not think that once I take a medicine, I take it lifelong. No. You can, with the help of a doctor, you can able to reduce, stop the dose, but make sure that you regularly check the thyroxine.
Okay. That was what I was going to ask you. Can we stop the medicine after a while?
Yeah, this is what, normally, as I told you, people have this fear of the medicine. First point, as I told you, do not be scared about the medicine, especially thyroxine hormone. It is 100% safe. I don't use 100 anywhere else, right? In medicine, we always say 99 with a caution. But here we can say 100%, because 100% safe. But when it is hyper, we do not say that 100% safety there. Now, in both these cases, your question is, doctor, should I take it lifelong? In both these cases, whether it is good or bad, we do not take it lifelong at all. Only in very few cases, I say, we may have to take it lifelong. But whether you take the medicine lifelong or not, one thing is lifelong for sure, is evaluation. You have to regularly check your hormones once you are hypo or hyperthyroid. That is for sure. But you may be able to stop the medicine, and you can stop the medicine also with the help of a consultant, and then follow up regularly. That is doable. It's never have a stigma that once I have a disease, my God, I have to take a tablet lifelong. It's a wrong statement. It doesn't happen like that.
So, what are the lifestyle changes you would suggest to control the thyroid problem?
Exactly. Now, when it comes to prevention of a hormonal disturbance or a hormonal disease, it is not that easy as we think. Like, for example, people ask me, doctor, what lifestyle modifications shall I do? Because I'm dealing with lifestyle diseases. They ask me what lifestyle modifications you can do so that I can treat thyroid. Now, let me say on a blind scale that there is nothing like for thyroid do this. No. But for your health, because say this is immune mediated. In that case, there is something that we can do in lifestyle to improve your immunity, to improve your immune status. They can help even the thyroid. For example, say if you are obese and you are overweight, controlling your obesity and overweight will be one measure to control your immunity, to help your immunity. In that case, controlling your weight, controlling your obesity itself will help you one way of controlling thyroid. So regular exercise, diet modification. Now, when it comes to diet modifications, patients ask, doctor, which food should I eat? Now, I cannot tell you that you should eat this food for thyroid, but you can avoid, for example, cabbage. Cabbage is one vegetable that is being documented, evidenced, that it can affect your thyroid hormone. So, I would personally ask people to avoid cabbage. Of course, there are a huge list of vegetables that is mentioned, but studies proved is based on cabbage. So, definitely cabbage we can avoid. Other things are on plus or minus sides, but I don't insist on a public scale. I would say cabbage as the only vegetable as of now that you should avoid. Then, there are a few things I could add on to, which is not that documented, but I can help in this way. One of the elements that can affect your thyroid gland as such is radiation. So, any type of radiation, try to avoid as much as possible, whether you have X-rays or CTs. Unnecessarily, do not get you exposed to any kind of radiations whatsoever, first. Secondly, forget about this X-rays and CTs, the radiation at home, what you're having. Say, for example, you have Wi-Fi router. I would prefer, why should you have your router in your bedroom? That is a place where you spend 8 hours of your day going to sleep, 8 hours is in your office. Make sure that the places where you spend your maximum time of your life, do not keep a router which is emitting too much of radiation. So keep your routers away. And the habit of keeping a mobile. Now, of course, mobile is supposed called to be the safest thing, which I don't know whether it is safe or not. But anyway, we don't want an argument on that. Whatever it is, it has also radiations, though it is safe. Let us make sure that you keep your mobile at least one hand stretch away from you when you are sleeping. Because we do not want, even if it is mild and safe, you do not want that radiation, because radiations are found to affect thyroid for sure. So at least when we are sleeping, whether it is for thyroid or any other reason, let us keep our mobiles more than one arm stretch away. Let us make sure that we do not keep routers on our rooms. So these are the few lifestyle changes that you can do, and make sure you stay a healthy life where you take more of fruits, more of vegetables, regular exercise. Now these are not just attributable to thyroid, but these are the lifestyle modifications that keeps your immune system healthy. If you keep your immune system healthy, the way or the chance it can attack your thyroid will be very less. Okay, so let us take a healthy and best immune styles or healthy lifestyle for your immunity rather than perspective looking into thyroid alone.
Okay. Doctor, we would like to know about thyroid cancer, the early symptoms and other relevant factors.
Very good. Now, when you come across any disease, any organ or any gland, the last thing to speak about is basically the cancer. But we do not want to speak much on it because it's not that very common. But there is one statement I would like to one statement I would like to make this. When I was being taught thyroid, I still remember my professor making a statement. This is one interesting thing I would like to say in public also. He is no more. So he said this in a class, stating that if God curses you one day, comes and curses you saying that you are supposed to deemed to have a cancer, but I give you a boon, choose the one cancer you want. My professor told me, ask God for thyroid cancer. Because anyway you want to have a cancer, you have a chance to choose one, choose the thyroid cancer. Oh, we asked, my God, why thyroid cancer? Because thyroid cancer is such a safe cancer. Not all of them, but the most common ones are absolutely safe. The moment you detect it, you remove it, you're perfectly fine. And interestingly, you know that once you remove it, you don't have to do anything. You just have to take one tablet, which is very safe. So this is one thing that will be just like any other disease, like an appendix or something, you removed it, but you just have to take one tablet, then it's all fine. So thyroid cancer, if detected early, is very safe and the best you can have, because you won't be scared about anything more. But yet I say that a very small percentage of thyroid cancers are there which is really malignant and dangerous. They are called anaplastic, it's a name, which is usually seen in elderly people and definitely not good at all. There are 4 types of thyroid cancer: papillary, follicular, medullary, anaplastic, of which anaplastic is the one which is the worst. Now, I don't want to be too much on these specifics, but I will tell you, now most of these cancers are very good to be treated, and it is 100% treatable also if you detect early. So your question was, how do I know? Now the basic symptoms of this, thyroid, as I told you, is a gland in the front of your neck. So if you see a swelling in the neck, if you feel that there is something that is disturbing you, which is not there before, you see a growth in the neck, don't think of what it as cancer, but do an evaluation, first point. Secondly, if you find that there is something that is pressing on it, now though you don't see anything outside, but you feel that something is tightening on your neck. When you are lying down, when you are sleeping, you feel there is a pressure effect on your neck. You find there is difficulty in swallowing. You find there is difficulty in breathing when you are lying. Think about thyroid and see a doctor. Third point, when you suddenly notice there is a change in your voice, you find that this was not like before, I have a change in voice, please do see a doctor. Along with that, if you find any of these conditions where you are losing your weight, you are having tremors, you are having emotional irritability, and you find that this is not what I am before, think about thyroid and see a doctor. These are the usual symptoms that we come across thyroid cancers as well.
Okay. Now, I would like to know more about goiter.
Yeah. Now, this goiter is a term actually. If you look at all the thyroid disorders we mentioned, we saw hypo, hyper, cancer. We never mentioned this word about goiter because it's actually nothing but an enlargement of your thyroid gland. Now, this is the stigma we had a long time back. We see people in villages used to have a long thyroid walking around. Now, we don't see at all because we have all treatment modalities for that. So, it's just an enlargement of your thyroid gland, you see. Looking at the mode, sometimes though you have an enlargement, your hormones will still be normal. So, you do not have to worry much about that. But if it is causing a cosmetic disturbance, you find it is growing and you do not want this in your body, you can go for a surgical excision. Otherwise, it is one among this group, either of hypo or hyper or a malignancy. But basically, goiter is just an enlargement of your thyroid gland. Yeah, if you see it enlarged coming out, you call it a goiter. Otherwise, you don't call this term goiter, you call it either hypothyroidism or hyperthyroid.
So finally, doctor, what is your takeaway message for our viewers?
Well, on this thyroid week, where the association basically wants to spread the message that thyroid will again be considered as one among the non-communicable diseases. And from my side, I would like to enlighten that what you have your idea about thyroid, you all believe that there is a thyroid. But let's understand, thyroid, the term itself is not a disease. All of us have thyroid. Second point, the thyroid diseases can be usually basically 2 types, hypo and hyper. And do not be worried about it. And third point is that the medicine, do not keep away from them. Do not have a scare, because this is not like a tablet that is going to act on your liver or kidney or pancreas or destroy this organ or cause side effect. No, the treatment for hypothyroidism is very safe, absolutely safe in any age group. And most importantly, this is the most common, or if you look at 8 women, 1 in every 8 women in the world is suffering from hypothyroidism now. Such a huge ratio, if you compare to men is to women, 8 women to 1 man is the ratio in the world. So if you look at among you, there's a very high chance many of you have gone having hypothyroidism. But the sad scenario is that much among the world, the population is being less evaluated and less known. So you suffer with this disease for years together before getting diagnosed. What you lose in this is the quality, the color, the harmony of your life. So my takeaway statement is, please do not spare your quality and color of your life. Check your thyroid.
Thank you, doctor. Thank you for joining us and giving us a lot of valuable information about thyroid.
Thank you. Thank you so much.
So viewers, as doctor said, if you have any symptoms of thyroid disorder, go for medical intervention on time and improve the quality of your life. Until we meet again next time, this is Jasila Mujib signing off. Good night.